MLT Case Study Series 32. A case study on the topic, Venom in the Veins, a case study on the critical role of laboratory diagnostics in snake bite management. Navigating the challenges of venomous snake bites through timely intervention and laboratory insight. Case study, John Doe's encounter with a venomous snake. Background, John Doe, a 35-year-old male, presented to the emergency department approximately 30 minutes after being bitten on his right lower leg by a snake. He was hiking in a wooded area known for venomous snake sightings. He described the snake as having a patterned scale appearance, which raised immediate concerns for a venomous snake bite. Clinical presentation, upon arrival, John was alert but anxious. He reported severe pain at the bite site, which appeared swollen and had 2 puncture marks. Vital signs were stable, blood pressure 130/85 mm of mercury, pulse 88 beats per minute, respiratory rate 16 breaths per minute, and temperature 37 degrees Celsius. He reported no significant past medical history. Immediate management, the affected limb was immobilized and kept at heart level to slow venom spread. A broad-spectrum antibiotic was administered to prevent secondary infection. Tetanus prophylaxis was updated. Laboratory diagnostics. As a medical lab technologist, the following tests were ordered and conducted immediately: complete blood count, coagulation profile, renal function tests, electrolytes and creatine kinase, venom-specific antigen tests. Results interpretation: CBC showed mild leukocytosis, possibly indicating an inflammatory response to the venom. Coagulation profile was within normal limits, suggesting no immediate coagulopathy. RFTs were normal, indicating no acute kidney injury at the time of presentation. Electrolytes were within normal range, but creatine kinase was elevated, raising concerns for muscle damage. Treatment: based on the clinical presentation and laboratory findings, it was determined that John was bitten by a venomous snake likely to cause significant local tissue damage, but without immediate systemic effects. The elevated creatine kinase suggested muscle damage, requiring close monitoring. An antivenom specific to the snake species suspected was administered after confirming no contraindications. Pain management, wound care, and monitoring for signs of systemic involvement were continued. Follow-up: John was admitted for observation. His pain was managed effectively, and his leg swelling began to reduce over the next 48 hours. Repeat labs showed normalization of creatine kinase levels, and no signs of renal impairment or coagulopathy developed. He was discharged with instructions for wound care and follow-up appointments. Conclusion for medical lab technologists: this case highlights the importance of timely and accurate laboratory diagnostics in managing venomous snake bites. Medical lab technologists play a crucial role in rapidly processing and analyzing samples to guide clinical decisions, monitoring for complications such as coagulopathy, AKI, and rhabdomyolysis, and communicating effectively with the clinical team to provide updates on laboratory findings. Understanding the clinical implications of lab results in the context of snake bites ensures that patients like John Doe receive prompt and appropriate care, minimizing the risk of complications and improving outcomes. Thank you. Please subscribe and support.